Hi, my name is Jim Fazio. I'm here with the founder, Dr. Paul Canali, Unified Therapy. We're going to be talking about one of the most important attributes that a human being can learn. That's one of the topics we're going to be talking about. And also, we're going to be talking about is the ability to have relationships with your mind and your brain to be able to change your thoughts. Can you talk to us a little bit about the question, what is one of the most attributes a human being can learn?
One of the best attributes or the most lasting attributes, because it's always been a question, as a human being, how do I grow? How do I develop? What is my purpose? What is the meaning of life? Today, unfortunately, again, we see events. We saw an event recently on Friday where there's a ceaseless act of violence, where a young individual does an event that's very, very tragic and very violent. Mm-hmm. And we see that these individuals basically have no control, right? No mm-hmm. control over impulses mm-hmm. and emotions, and they take it out in a senseless way. Mm. But for the most of us, we see today, especially today, so much dysregulation of the ability to have self-control. Mm. Well, we see things like a drug addiction reaching astronomical new levels. I mean, recent statistics up 35%, in Middle America up to 90% or more. And of course, these people, if they had a say, right? If they had a say in the choice to do it, obviously would say, wow, I could see this is going a bad place. I don't want to, right? I don't want to go that way. Little did we know that so much in our life is controlled, of course, from higher processes up in the brain. And so often you're going to hear us talking about a particular part of the brain called the middle prefrontal cortex. The ancients maybe used to talk about that area as the third eye, but in all practicality, I mean, it's a real physical thing. Any neuroscientist can say, hey, that exists. It doesn't even fully get developed, seemingly again, until your mid-20s or later. But somehow in that special part of the brain, it houses the most cherished properties that a human being would want, including the one that all of us could see right away, is that if a person had compassion, true compassion, which you often see in the quest for spiritual practices, it's impossible to begin to hurt somebody, right? It allows empathy, it allows feeling, but its greatest potential is that it allows you to regulate your emotions, right? So we know, I mean, dealing with thousands of patients, and everyone knows in their own light, one of the most detrimental things, of course, is our own thoughts, right? That so often when these things come up, we have very little ability or tools to change it. Even anxiety, I mean, years ago in my practice, I mean, even 10 years ago, I never saw a child with anxiety disorder, 15 years ago. Now there's not a single week that doesn't go by, with a child being overwhelmed with intrusive thoughts, of anxiety that they can't seem to turn it off. Now that's children, you can imagine an adult. Also, we never realized that these powerful processes could be channeled through the brain and cause a non-integration and end up as back pain. I mean, that's unbelievable. Or chronic pain, the number one condition in medicine, right? Or seizures, or all kinds of disorders, right? So we're becoming more acutely aware that something's wrong, and so if we could give people the ability to change their thoughts, meditation, the basic form of meditation was designed to quiet a person in a certain place, and then quieting in that certain place, it wasn't just meant to be quieting, it was meant to be deeply relaxed but also profoundly alert. It almost seems like a contradiction, right? So how could you be deeply relaxed but also profoundly alert? And profoundly alert to what, right? Profoundly alert to critical information that is not of the fear brain, that is not of the survival brain, but a part of us that gives us insight, knowledge, and purpose, and meaning. You know, as we evolved in the practice, that was one of the most profound things that I started to realize, that because in our sessions, as you know, just like exercise, you want to increase things. You want to make a person uncomfortable. And I think the exercise model is very good. Or we were talking about in Orange Theory, because they have a certain way, they're like, there's a critical place where you want a person to get. You want them to be uncomfortable. You want their heart rate to get up.
Yes.
In Unified, we want you to feel things that are buried. We want you to feel things that are uncomfortable. But we don't want to leave you there. Just like in exercise, you don't want to leave a person with their heart rate at 150 beats per minute. You want to be able to have it come down and then actually go lower, because that's the fascinating system. This whole autonomics is just basically about dealing with energy. And when you deal with energy, you have to be familiar with it. You have to get used to it. Back to the thoughts again. So when we talk about the thoughts, it's the most important thing that a person can actually be able to shift their mind, to shift their thoughts. That's one of the things that can do. There's a lot of talk about mindfulness, you know, that basically, of course, came out of the Eastern schools, and particularly from the Buddhist type programs, you know. But basically in mindfulness, you know, they're saying try to be aware, try to shift your attention to being in that moment so there's not a lot of thoughts going on at the same time. But the difference is, in Unified, what we want to do is, we don't just want to sit there calming. The skill that you must learn, like exercise, and eventually do it at home, is be able to find peace, and then think of something that's really bothering you. Yeah, wow, there's this problem with my boss. Every time I think about it, I feel a tightening in my stomach. It really disturbs the peace. Now bring yourself back to peace. Now you have a real skill. I'm thinking about something that's going on with my husband. Now, he's never paying attention. He's in his own world. No matter what I do and say, I can't reach him. You want to do that. See, if you know how strong you are because you bring that up, and then you try to find your way back to that place of peace again. And when you do that, the potential energy, the difference from excitation to the part where you're feeling peace again, there's a net change of energy, and that energy causes liberation. I know that for myself, it's when I get the deepest places of joy. It's like I may be in a nice peaceful meditation, but now I start to activate the other parts, simple parts. Sometimes it's like, I don't want to sit here anymore. I want to do something else. I want to get up. I feel all that happening. But then I work with shifting that thought, and as I shift that thought, and it goes away. I mean, it literally goes away. I have to remind myself that that thought was there. There is a sense of joy. There's a sense of enlightenment that comes up. So you'll see the story of enlightenment in many of the great teachers, the gurus, the spiritual people. They're always going to tell you they went through a time where they actually had to sit down and they had to open up stuff inside them that was very uncomfortable. And as they moved from that uncomfortable part, something shifted, right? And there was a great sense of peace.
How long does it take someone to be able to shift that? Are you talking, can someone do it another way besides coming in and getting regular Unified Therapy sessions?
Good. So the first thing is that most people's nervous system, as you can see in the world today, is dysregulated.
Yes.
People do these crazy things. I mean, like you said, suicide is up, right? I just saw it last week or 2 weeks ago in USA Today. There was an article in there, and it said the #1 cause of death for first responders like firemen or policemen, you would think is, well, it's obviously some criminal or something is going to shoot the policeman, or the fireman is going to get stuck in a fire, or even that we see there's increased rates of cancer in firefighters and first responders. It was at their own hand, right? So these are all, this is very, very important, because these are symptoms of a greater disease, right? These are, as a physician, we're always taught to look for symptoms. Like, Jim, you have swollen glands here, you're feeling malaise or tired fatigue, you have a fever. Those are symptoms that tell me, oh, maybe you have an upper respiratory infection. But then there's more serious symptoms. Boy, you have lymph nodes there, and you may have a neoplastic growth, right? So I'm supposed to read the symptoms.
Got it.
We as a people are supposed to realize, whoa, 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 something's really wrong.
Yeah.
It's time to change direction. In Unified, we've tried to look at all the potentials. We looked at everything in mental health. Do you realize there's almost always 200 different techniques in mental health?
Yeah.
Why would there be 200 techniques if there was one particular understanding that was working? Why do you have to keep reinventing the wheel? Because it's not working, right? Now, some work a little bit better for this, some work a little bit better for that. But the big thing that they understand in mental health, which a lot of people don't always want to talk about, it's mostly affected by the relationship. How that person working with their therapist feels that that therapist is listening to them, connected to them, is interested in them, healing starts to happen. On Good Morning, not Good Morning, maybe, but CBS Sunday Morning. I like to watch that show on Sundays. About 2 or 3 Sundays ago, there was a story about a lawyer. This woman who was a lawyer in Washington, going about her normal life, and then one day, called divine intervention or serendipity, she ran into a homeless person. Now, most of the people what do? They walk by the homeless person or, here, don't bother me. But she engaged that homeless person, and she sat there and she listened to him. And in the listening, a healing happened. Not just for the homeless person, because the homeless person said, wow, no one's really ever sat down and listened to my story. No one ever saw me as a human being, right? And she was so moved by that. She did something wild. She put an ad in Craigslist and said, if you want to tell your story, I'll listen, basically. She thought, you get one person will call. Many, many people started to go. And as she started to be a good listener, and she started to take down all these detailed notes, she noticed that was a catalyst, and people began to heal, right? Of course, on the program they get a mental health guy and say, well, this is incomplete. But you see the people's stories and they say, this person changed my life. There was one man in there, his wife was an alcoholic. She died from alcohol poisoning, right? But he said, I just wanted to tell somebody how good my wife was, that she was a good person, and how much I loved her. And in that, no matter what other problems she had, but there was a healing. So going back to, so before we get off the subject, in psychotherapy, yes, there are some techniques. Cognitive behavioral therapy had a little bit better on others. And incidentally, the secret with cognitive behavioral therapy, which kind of took psychotherapy by storm, was 2 basic things. Your thoughts are creating most of your problem. I repeat, your thoughts are creating most of your problem, and if you can get control of your thoughts, a lot of your problems will go away, right? And the second one is what we talk about a lot too, is that behavior, that your brain and your body is conditioned by experiences. And that's why in Unified it's so important to do these things, because no matter how much you try with your mind or your brain, you cannot overcome often the body, the biophysiological thing, because basically the unconscious mind, where most of the stuff is in the body.
Well,
right?
doesn't it go back to cognitive behavioral therapy if there's a shift in thought? So how does Unified kind of differ than that?
Oh, like I said, the shift in the thoughts is a good thing.
Yes.
And if somebody can get the shift in thoughts, but what they don't recognize, you can do this, and if you look at statistically, it takes a long time. The standard for the therapy takes many years to get a positive result.
Got it.
So, that's all well and good. But when you can shift the biology, when you can shift the physiology, one quickly goes to the place. Like yesterday I had a patient come in, and we give a lot of questionnaires asking people about their past experience in their life, the Center for Disease Control, the ACE score, different traumas, experiences. Well, he put basically nothing. You know, when I see that, there are nothing, I never had anything really wrong with me. No bad experience in life. He had a few on the trauma score, loss of a father, loss of a mother, stuff like that. That's understandable. But he wasn't giving me that much, and I said to him, is there any other stressors going on right now? He said, no. He says, I'm just in really, really bad back pain. I mean, he was scared to death because a certain way when he moved, it caused excruciating pain. So he was petrified. He could move, but all of a sudden it was like crippling, and he would be down on his knees. So I said, you know, he's talked about the history, and I asked him about some of the medications, and I noticed there's a medication on there, and he said, yeah, that's for restless legs. And he said, boy, I saw when I mentioned that, your eyes light up. Because to me, that was a clue. So restless legs is this condition, just like it sounds, that there's an uneasiness, there's a restlessness. It's actually only in the form of an anxiety inside the body. And the body at night, the legs are constantly moving or running around. Or if you're sitting in a plane, he says, I could sit in a plane, I'm banging the seat in front of me. You can understand why, because our physiology is geared to fight, flight, survival, right? And if he hasn't dealt with that energy, right, he can try to be as mindful and do as many meditations, but until that fear came out. So we started working, and then sure enough, I talked to him about certain issues, so that's where talk comes about. And it's normal that as an older person, a common fear is, what if I can't take care of myself? What if this is going to get worse? Why would I do that? To make him feel bad? No, I did it to bring up energy. And when I told him about it, I said, now what do you feel? He said, oh, you hit one there. And I said, good, that's what we want. Where is it going? It's just all of a sudden, like in Orange Theory, they're saying, Jim, your heart rate is not fast enough. I need you to go faster, not too much, not too little, but just the right amount. So the same thing. So what missing from, again, standard therapy is, in fact, they're quite frightened of it. They don't want to make the person upset because they don't have a way to bring them back to peace. That's simple. So what happened with him? All of a sudden, one thing led into another, and his whole body started moving, the legs are shaking. The beautiful thing, he's laughing at it too. He says, I can't believe it. I can't believe it. And he says, you know what? I realized something came up. Can you share that? He couldn't share it right now. I said, that's fine. You don't need to share it right now. See the difference is? You don't need to share it. But you need to be okay with what he says. Yeah, I realized my whole life I've been in fear and worry. Boom. And then the body started to go what we call this homeostatic reflex, and it began to shake and move. And he's laughing. He says, I can't believe it. I can't believe it. This is really happening. This is really happening. And then, you know, the fairy tale ending, right? Doesn't always happen like that right away. It's like no pain, because you couldn't move. You'd move his leg and he'd be petrified, and he'd go through cramps, spasms. He was petrified. He was really afraid, don't move me because of the pain. So you had to be very gentle. And eventually he's moving, it's coming out, and it took him a long time to come back to our normal waking state, because he had been shifted in this place, and he wasn't used to it, and he had been such a long time in not peace.
Got it. Do you think we have any questions in the audience? Do we have any questions?
Can you feel the joy without going to the place of talking about the deep, dark past and the stuff that hurt?
So, joy is basically a normal human state. Happiness really is the normal human state. If you look at children early on, before they get affected or overwhelmed by life situations or adverse childhood experiences, normal state is joy. They do joy pretty quickly. They can be crying, 2 minutes later be very joyful, right? Back and forth. Human beings begin to lose that state, and they don't know what that place is, right? And they forget what that place is. And the danger is if you get too far down the road, you know, like a classic post-traumatic stress, they know the event is over, but they've lost the joy. You know, they lost the purposeness. Like you said, we're talking about these firefighters, we're talking policemen, 22 soldiers kill themselves every day. They lost the joy, they lost the purpose. And so here we have this amazing, wonderful, we want to bring it to the world, a tool we can teach other people to start to bring the joy. But you got it. Once you get your joy, you don't want to let it go again. We've become so disconnected in our lives, and we're seeing the result of it. It's like, this is madness. It's madness at an extreme, right, in our world today, right? And we need to get back to these things. We need to know how to have a sense of community. We need sense of connection. We need sense of relationships. These are all very, very important. But no greater relationship can exist than that within your own self, to be able to bring wow and the calming and get used to it. What happens in a session, which has happened with this guy too, is they think it's about the pain, but then after they realize it's, which is what she said, you get this sense of bliss and joy. Once you know that's there, then you can start to bring it up even in your own life. But if you don't know that's there, they don't have any sense of it. Or know how to work with
the energy.
So even today, there's a lot of people doing different types of shamanic practices that involve different type of psychedelic processes. Those that involve things like ayahuasca, psilocybin, mushrooms, bufo alvarez, believe it's from a desert toad, the secretions from the back of the glands. What happens though is that they're looking, they want to wake up, but they don't know. And it seems like they're trying to take too much of an easy route. It does, because I've been able to study hundreds of them. Sometimes it does have a positive benefit. They get a chance to feel for the first time a sense of joy and peace that they may have never felt, right? And they also get in touch with information that previously they wouldn't. Now, even in organized medicine and psychiatry, they're reintroducing the use of possibly mushroom psilocybin, because there's been a couple cases where cancer patients suffered from intractable depression. I mean, it's not responding to any type of treatment. And the psychoneuroimmunology means that your state of your mind affects your immune system in a big way. Every cancer person that I've seen that had a spontaneous remission meant that their diagnosis was disastrous, every single one I see, they had some kind of change in their thoughts and their mind. And in that change of mind, it seems it has a positive effect on the immune system. So, but the point about these things, they can bring you to at least know that's there. But you don't want to continue down that process, because you have to do the inner work. Well, where do you go? Who do you turn to? Where do I go? How do I know? So you need something that's very highly reproducible. It's not just isolated, because in Unify, we look at all the mental, the techniques, but we also look at every physical technique, because who could ever imagine, and the medical community doesn't even know or look at the data on, or that we know that certain types of hands-on or body work produced altered states of consciousness, from the most basic early stuff from people like Ida Rolf, or as Tom Myers, which Jim had worked with, that a way of moving, working with the body started to bring up motion and memory, right? And it was like, but they didn't understand how or why, and they made up chaotic theories about how that was happening. Same thing in psychotherapy. There's a thing called EMDR. So how could something as simple as following your finger or touching opposite parts of the body bring up new bits of information? Well, I think for the first time, Unified, we have at least a good theory, where most people don't. They don't have theories about it, and they don't understand. And then movement. I mean, there's been so many new understandings about movement, from yoga to Feldenkrais to Kundalini yoga, these types of things, breath work, changes in oxygen, pH. So if you're going to really approach this, and then like I said, in the spiritual practices, there's genuine, very good stuff that came out of it. Even if you don't have to believe necessarily in a higher source, the practices itself has a very positive benefit and outcome, right?
Any other questions from the audience?
One more.
Go.
How is it different than The Secret or The Law of Attraction? Because that's all about your thoughts and
Okay.
changing.
That's a good thing. So those things which I call are theory based. So theory means it's like a person that for many, many years they believed it was possible to fly, right? To fly through the air, right? But it wasn't until somebody like the Wright brothers and those that followed, they put a theory into practicality. So the thoughts is correct, yes, if you could change your mind, but they offer no application. It's just go ahead and do it. And that's the failure of all these things.
Yeah.
One of my so-called heroes is that I really like is a psychiatrist named Bessel van der Kolk, right? And he wrote so much about trauma and trauma in the body, a pioneer. But when I was sitting one day having lunch with him, he turned to me and he said, Paul, you know, it dawned on me that I know so much about the theory of trauma, the biology, but I have no methodology. Now I turned to him almost with embarrassment, and he says, I've written all these books. And I said to him, I said, oh boy, I've got to have to say this. I haven't written any books. He's asked me, Paul, when are you going to write a book? I said, I haven't written any books. But I spent a lot of times actually having a method, right? You have a theory, you don't have a way, and test me. That's all I'm saying. Don't just dismiss me, test me, right? So if I can produce these results, right? If I can take a shift in the world, in all these things, at least challenge me, talk to me, and then say, hey, let me see it, let me experience it. Because I always say too, you experience it yourself. So you said, well, I'm thinking about my patients. I said, you need to go to this place first, and then you'll understand. And Jim knows himself. There's many, unfortunately, I remember, here's a perfect story. I was giving a request to go to Fort Carson. It was a #1 base, Army base for PTSD, right? It was in Colorado Springs. It's a big honor for me. I mean, this doctor, this chiropractor, to be invited to talk and help them, and the therapist and the base commander made a speech and so on. So I'm there presenting, and then it came time to actually work on the different therapists, and almost all of them were mental health based. And the darndest thing happened. What came up in them frightened them so much, right, that they were overwhelmed by it. And they were like, I don't want to feel this. I don't want to cry. I don't want to express. And I said, then you'll never know the secret how to help heal other people. Because you're so frightened about your own feelings, your own vulnerability. If there's one thing I'm going to teach you about healing, is there one thing about connecting to higher sources, is vulnerability and surrender. Right? And there is a moment when all of us have to learn how to drop our guard and surrender. Are you going to do that with most people? No, because most people are not safe. Most people are not present. But you may run into a person that's very safe and you can surrender. Or you may be sitting in a beautiful mountain setting and feel that presence, but you're so afraid of your feelings that you don't surrender. You may be in a church, you may be in a temple, you may be at a concert, but if somebody hasn't taught you what surrender feels like, you're going to stop it, as I did for most of my life. The answer is, on the other side of that is the joy you have known. Now, did it come from me? Did it come? No, it's something that happens spontaneously.
The biggest question I get, though, is how do I do that? How do I surrender? That's where you have to go. It's like if you want to learn to be an ice skater, you hire somebody. If you want to be an athlete, if you want to be a musician, the best way to do it is not just bang out the keys on the piano, is hire a teacher, right? So in Unified, that's the beginning. We lay the groundwork. Once you get to a certain place, you can do this, but you always want to go back to somebody. That's the catch of human beings. The greatest catch is we need each other. Do not ever think that you can escape that. Our biology is hardwired for touch. Our biology is hardwired
for connection. My eyes meet you, there's a certain connection. And it's interesting because even in other species, it's very interesting. In dogs, no one ever thought of this, that they can release oxytocin when they connect to their owners and they're looking each other in the eye. What's oxytocin? Oxytocin, as far as we knew, was the bonding neuropeptide that's released in connection. So when a mother starts to put a baby on the breast, I mean, she's stressed out, she's overwhelmed with everything, but that baby suckling the breast releases this calming hormone, and they begin to fall in love. It happens men and women, it happens with people. What the fascinating thing is, nature, God, I don't know what it is, evolution has also recreated in animals. And they found that Japanese just did a study that if there's a certain time and connection when the owner is looking into the eyes of the dog and vice versa. Now watch this, not only the owner, but the dog themselves now gets an oxytocin release.
I do that all the time with Jack. He just looks at me like he sees my soul. And he's just a little
There you
dog.
go.
And he will, no matter what I'm doing, if I'm sitting watching TV, I will look down and he's watching me. And I start watching him. And it's a piece.
That's exactly
It's a
it.
piece.
You hear what you just said?
Yeah.
And it's a real piece. It's
Yes, it
something
is.
real. And you just asked that question. These are things that we want to recognize, and you want to stay present, because if the mind is so distracted, if the physiology is in survival, you won't be able to connect to that. But the more you're present, the more you're calm, the more you can enjoy that moment. And now think a mother and a child, you know,
Yes.
because so often the mother is so busy and she cannot be present, you know. I remember years ago when I was going to have my first child, and there was this woman, Judith, had worked in my office, and she had done a lot of different healing work, and she had studied in different modalities, including the Barbara Brennan School, but she had a mental health degree too, I believe. But she said to me, she said, "Paul, I could see you're a bit nervous about being a father, right?" And she said, I said, "What's up?" She said, "Well, I'm worried about the time. And she said, "Let me tell you a secret. It's not the time, it's the amount that you make connection." She said, "So a lot of people can spend hours with the children, but they're not really there. They're not present and connected." She said, "If you can give that child 15 minutes of genuine connection, it makes all the difference." And she was absolutely correct. Because when I see with my daughter, I'm really paying attention. When I can really get down and get into playing with Lego blocks again, something magical. I'm telling you, then she comes over, she'll hold me more, and I'm like, oh my God. And she's kissing me more. And then I know to open up to receive that. You see, and I know the power of that connection. I learned that even years ago when my brother had divorced his wife, and I had 3 nephews that lived in another part of the state, Jacksonville, hours away. I had to get there by plane. But I learned a secret. Whenever I was down, even physically ill, like I had a cold that wouldn't go away, I'm going to go see my nephews. Why? Why? What do they have? Do they have some special pills or medicine? Is there some grass that you eat over there? No. I would be with them, and they would be all over me. They would hug me, they'd touch me in a way that I wasn't getting. Right? I had girlfriends, I had lovers. This was a different thing, right? And they would love me, and they'd hold me, and no matter what it was, my body would heal. I learned that secret, and I would purposely and to this day we developed quite a bond, because Uncle Paul was a different type of person, you know. And I'd take him on adventures. I loved it. It was a two-way street, but I learned the power of being present, and almost embarrassed sometimes, because I would sit, you know, because I wasn't so used to it. I'd close my eyes and I'd feel them hugging me, and you could be not present when somebody's doing that, or you could be, oh my God, I feel energy. I feel warm. I feel heat. I feel a little tear. Oh, don't be embarrassed because you're feeling the little tears, which in the past I would have been. I would have stifled it, which is what we all learned to do.
One more question that the audience brought up was, how long would it take someone to be able to get a grasp, to be able to shift their mind, and is it something they have to do on a regular basis? I mean, can you explain that?
So is it something you want to do on a regular basis? Absolutely. Do you want to eat healthy on a regular basis? Yes. Do you want to do cleanliness on a regular basis? Yeah. Do you want to exercise on a regular basis? Yes. It doesn't have to be extreme, but you want to do it. And the mind is a tricky thing. If you don't keep it skilled. But it's just like I said, a piano player or a dancer, they practice very basics almost every day. But even if you don't practice for a while, you don't lose the skill, right? But it's something, once you attain it, and in neuroscience we have a thing, it's called potentiation. So potentiation, you must, if this is one set of nerves and that's the other nerve and there's a gap, to learn a new skill you have to fire. That means do the same thing over and over, and then it wires. In the same way though, to take out a negative, because it's mostly the negatives that stop us, right? You'll think, I'm not good enough, I can't possibly do this, it'll never happen for me, nobody ever cared about me, the world sucks, people sucks, this is not possible. Those are so strong, so you have to disengage them by creating peace, and then in the deep hours of sleep, right, in a particular brainwave pattern, because there's beta and alpha and theta and delta waves, but we know it, there's a certain brainwave pattern, and when you're in the deepest sleep, it pulls it apart.
When you talk about skill, before we have to close that, what do you mean by that? Explain that to the audience. You want to develop a skill regularly.
So skills, these are skills of the inner world, right? So it is something very few people have ever learned, right? And so like we're saying too, there's people, I mentioned him before, people like James Heckman, right? James Heckman is a Nobel Prize winner in economics, right? But he is concerned, or even thinking maybe that the future of this country has to do with a thing called these inner skills, the soft skills, right? Hard skills is 2 + 2 is 4. What is the capital of New Jersey? Soft skills is, boy, how do you quell yourself? And you get so much anger and rage. You just want to kill somebody. What do? Or you feel hopelessness and despair. You never felt support by your family. You feel your teacher doesn't see you, right? How do you learn? Like I said, in this country, we know we have one of the highest college entrants, but we have one of the highest college dropout rates. People can't handle. And today, with so much attention on external devices and screens and computers.
Overstimulation.
They don't, well, it's not even overstimulating, it's not developing the pathways to being still and being okay with being uncomfortable, being okay with being bored, right? Because out of that is where ingenuity, where out of imagination comes the knowledge of the future, right? Out of that place. But you have to be able to sit with that. You have to go through uncomfortable. Just like we said, you can't get to running the 10 miles until you make it around the block once, or make it past a half a mile. Most people, if they don't have the support. So it's a tire shift at this time that we have to really start working on. Unfortunately, again, in that model of soft skills, most people don't have any idea. They have theories. Oh, we need to do this and do that. Some are better than others. But they must learn the secret of self-calming and self-regulation.
People coming in regularly, doesn't that give them a sense of codependent on the therapist to get them to a certain level? Where is the separation between codependence and going somewhere as a trainer to keep moving forward?
So the importance is that eventually you want them to become more and more aware that this thing is self-generated, that there's something inside themselves, so that they can reproduce it. Because let's face it, you only have an hour, 2 hours with that person. You want to remind them, you want to be able to soak that state, but you have to do your homework, right? So it's like you are in the classroom, and Johnny comes in and she says, well, Johnny, you're very good in the classroom, but you never do your homework, right? And so I can't pass you in this class, right? So you have to learn and do the homework at home. And as one does the homework at home, when one follows and practices, they become less dependent on. It's very simple.
So they don't
it's like
need
you have
as
to
much,
do
and
it. You don't need, you know, once the trainer teaches you how to work out, it's like, I got it.
But that would only get you so far because you need another person to get you to that next, you know, it's hard to do
Initially,
that, right?
so initially people, and we're always wanting to have somebody where we can go. These should be set up in every town, in every state. When people are overwhelmed and people are stressed out, they can go to this place, no questions asked, come back to peace.
Yeah.
I want to do something drastic. I want to do something bad. I'm having anxiety. I just got a diagnosis with cancer. If they know they can go to a place,
Got it.
and they know that in that place, everything in it is set up to create that state of peace, that state of joy. That they have people that have been in my office, no therapist, I will not take any therapist if they haven't been through the process,
Got it.
because they speak with wisdom and
Yeah.
knowledge. Unfortunately, most people get their education in traditional systems. I can't tell you how many therapists I see, especially in mental health, and they have no experience within regulation of their own physiology. And so, as Charles Figley said, they get compassion fatigue. They get burnt out. They get burnt out very quickly. They don't have a regulatory mechanism. They're done. So, and you know, my thing is I want to get this out to as many people and as many therapists, and so because Unified can be applied across all the applications, no matter what you're doing, right? Because it's based on common unified practices, and we don't ever want to leave anybody out of the equation. Most therapists is like reinventing the wheel. Oh, I discovered this, I discovered this. Well, wait a minute. How about this person? And how about this person? How about that person? There's so, in Unified we identify dozens of people that have put into the equation, and don't say, oh, you know, I'm the new prophet, I'm the new one that all of a sudden had this insight. Unfortunately, I see that all the time, and it actually makes me quite upset because there are so many good people that came before them that they don't mention, that they have no connection to, you know, and you see that all the time.
Got it.
And it's never going to be respected until you put it together as a
Yeah,
unified theory of everything.